those adults 20 years old and above, screen them, and then diagnose. No, out of the screened 80%, we would like to diagnose who among them are positive or negative. So 80% will be diagnosed, no, out of the 80% screened. And then those identified to be hypertensive will be, ang target natin is 80%, no? Of them will be, of those identified with hypertension, will be put on treatment. And then, the 80% on treatment, we want them to be on BP controlled, no? 80% of those 80% on treatment will be to have BP controlled. So, nalilito ba kayo? Hindi naman siguro. Klaro naman po. Klaro naman po ba? Yung 80, 80, 80 na yan? Yan po kasi yung formula natin para to achieve the 50% control rate, which is among the priority health outcomes ng Department of Health at present. We want 50% of the population with hypertension to be on controlled blood pressure, no? Klaro po ba? Klaro, ah? Alright, sige, thank you. Next slide. So these are the strategies, no? Nationwide communication and behavior change campaign, region-wide hypertension screening and treatment, nationwide synchronized screening month, strengthening health systems, public-private collaboration to expand reach and sustainability. Next. These are the guiding principles. This is DOH-led but multi-sectoral in implementation. So everybody works, no? For the proteksyon para sa altapresyon. Everybody collaborates, di po ba? Public-private, there's public-private partnership. Everybody from national down to the LGUs, they coordinate and work, no, for this proteksyon para sa altapresyon. Okay, nationwide in scope but regionally driven for scale up. So just like what we are doing, no, regional ang ating pagro-roll out ng proteksyon para sa altapresyon. Coordinated financing, ibig sabihin, nagko-coordinate from national down to the LGUs para ma-identify naman kung ano ang kailangan ng mga LGUs, anong support, especially when it comes to logistics, no? Procurement of medicines, to make it really available for our target clients. It is multi-pronged and coordinated intervention. So, maraming combination na intervention dito, no? Hindi lang isa ang ina-apply natin, pero coordinated for PPSA. A programmatic approach, and again, public-private collaboration. Next. This is the phases of the implementation. Preparation started in 2025, rolling build-up in 2026. Just like what we are doing now, we are rolling, no? Doing the rollout of the PPSA, no? In the different regions. And then nationwide synchronized screening, month of May yan. Sustainability and institutionalization from 2026 to 2027. Next. So these are some of the activities. National communication plan designing and implementation, adapted by the region in their own version for local context. Activities include public awareness events, public policy advocacy, regulation enforcement, support for healthy behaviors. Next. Hypertension and NCD risk factor management via 𝗟𝗏𝗏. So we do capacity building. We deliver services, no? The deliver services, screening, diagnosis, management, referral, all of this, using the 𝗟𝗏𝗏 protocol. Ang Region 7 po, ang mga staff dito ay in charge po ng NCD, ay na-train na po sila. Kasama sila dun sa training of trainers on hypertension, prevention, and control. Okay? At saka dun sa updated 𝗟𝗏𝗏 protocol. Then, we do counseling on diet, exercises, smoking, alcohol. Very important ito. Parating kailangang i-emphasize, i-reiterate. Kasi, pag hindi, dito po talaga, hindi natin makokontrol ang hypertension. Kung wala tayong disiplina sa pagkain, hindi maawat sa pagkain ng maaalat, hindi walang galaw-galaw, maghapon na lang nakaupo, subsub sa trabaho sa maghapon, uuwi, subsub pa rin sa upuan, sa sasakyan, biyahe ng 2 oras. Ganyan ang buhay sa Manila. 2 oras like me. 2 oras ang biyahe pa uwi ng Lagro. Nakaupo. Pasok na naman ng umaga. 2 oras. Tapos pagdating ng opisina, upo pa rin. Walang masyadong physical activity. Sedentary. Very sedentary. So, we have to do something about this, mga ganitong lifestyle. And then, smoking, alcohol drinking, vaping, and of course, stress management. No? It's very important now. We discuss this to our clients, stress management, because stress management is part of our daily living. So, work is very stressful. Halos minuminuto, merong urgent. Minuminuto, may kailangan tapusing report. May kailangan tapusing isubmit. Experience niyo po ba yon dito? Hindi niyo na-experience? Ayun. So, di po ba very stressful? Oh, so anong ginagawa natin to manage stress? May I know? Ano po? Ano daw? Tagalog ako, hindi ko maintindihan ng Bisaya. Zumba. Yan, oo. Oo. Very good. We should find time to unwind, to relax. Kaya nga meron tayong healthy, yung wellness break. May wellness break kayo? Ayun, kailangan relax din pag may time, di ba? Unwind din. Hindi pwede, puro stress, mamamatay na tayo sa stress. Diyos ko. Grabe, Director Subaan. Daming trabaho sa opisina. Oo. Kaya yun, we should always, be kind to ourselves. We have the 12 S, no? Di ba? Sa iwas stress or manage stress. Or just to share, no? Just to discuss a little bit about this 12 S. Speak to me. Or talk to yourself. Talk to yourself. Yan, isang S yun. Kausapin mo yung sarili mo. Pagod ka na ba? Sakit na ba yung ulo mo? Nahihilo ka na ba? Aba, itutuloy mo pa ba ang trabaho mo kung nahihilo ka na? You check your BP, baka mataas na. So you have to rest naman. And then continue na lang later. Importante mag-rest. And then yun na nga, speak to people. No? Pag may nararamdaman, you ask assistance from others. Medyo, I'm not feeling well eh. Can you, may I ask help from you? Can you, pinasa na yung trabaho sa kanya? Hindi naman. Oo, pero siguro konting alalay. And then, indulge in your favorite hobby or recreation. Sports, Zumba, songs, ganyan. And then, one favorite ko is yung increasing your spirituality. Yan, be prayerful. Alam nyo, talagang prayerful is very, very powerful. Malaking tulong sa atin, to manage our stress. And other kinds of stress pa po. Okay. So, we also have this supervision and quality monitoring, referral, and BHW involvement. Next. Screening and treatment activities. So we prioritize provinces, cities with high unmet needs. And then the platforms are Puro Kalusugan, Bukas, Love for All, May 2026 month-long synchronized screening. Next. So for coordinated financing and registry, we have here the DOH providing population health services. PhilHealth covers diagnostics, treatment, and then we have this national registry through iClinics, and then we interlink with PSA, Philippine Statistics Authority, DSWD, PhilHealth, for other assistance, to our clients, related to financing, financial needs, ng ating mga target clients, and for registry, for data on hypertension. Okay, I think this is my last slide. Next, please. So I would like to leave you with this message. Bawat buhay ay mahalaga, kaya't kalusugan, pakaingatan. Proteksyon para sa altapresyon, ating isa puso, isa buhay. Yun lang po, maraming salamat.
All right, thank you very much. Thank you very much, Ms. Hollandes, for the very detailed presentation. It really gave us a perspective on all about the details of this program, and furthering what we know and what we ought to know about proteksyon para sa altapresyon.
All right, you are exactly right, Jay. We are grateful to hear from our speakers on the overview of this program, as well as the global situation. Now it is point to give your message of support. Representing Governor Pamela S. 𝗟𝗏𝗄𝗆, please help us welcome the Executive Assistant to the Governor, Attorney 𝗟𝗏𝗏𝗀𝗏𝗃. A round of applause, please.
Good morning, everyone. It's unfortunate that Governor Pam could not be here, but believe me, she wanted to be here. But nonetheless, she has left a message for me to read to you guys, to everyone here present. If I may, maayong buntag natong tanan. Good morning, everyone. Please accept my warmest greetings and my sincerest apologies for not being with you personally today. I would like to congratulate the Department of Health Central Visayas on the official launch of protection para sa altapresyon here in Cebu Province. As most of you know, healthcare has always been my #1 priority. I firmly believe that prevention is just as important as treatment. High blood pressure is often called the silent killer because many people do not realize they have it until serious complications arise. That is why initiatives like this are so important. They empower our people to take charge of their health before illness takes its toll. I am grateful that Cebu was chosen as the pilot province for this initiative. It reflects what we can accomplish when our national agencies, local governments work hand in hand toward a common goal of protecting lives and building healthier communities. Rest assured that the provincial government of Cebu remains a committed partner of the Department of Health in strengthening preventive health care, improving access to medical services, and promoting healthier lifestyles for every Cebuano. Together, let us continue ensuring that every Cebuano has not only access to health care, but also the knowledge and opportunity to live a longer, healthier, and a more productive life. Daghang salamat ug maayong adlaw kanatong tanan.
Thank you very much, Attorney Dinsay, for that very inspirational message of support. So very heartfelt as well.
Yeah, indeed. In our activities and programs, we're truly grateful for the provincial government of Cebu for its unwavering support. As always, James.
As always. So at this juncture, to give another message of support, she is the current World Health Organization representative to the Philippines, a board-certified pediatrician and public health leader from the Republic of Korea. She has dedicated her career to advancing health systems, primary health care, maternal and child health, and humanitarian response across the Western Pacific and beyond. She served as WHO Country Liaison Officer in Vanuatu and the Northern Pacific, and previously led maternal and child health programs in the Laos People's Democratic Republic before assuming her role in the Philippines in 2026. She has worked with Doctors Without Borders in various countries such as Niger, Sierra Leone, and Haiti. She holds a Doctor of Medicine degree from 𝗟𝗂 Women's University and a Master of Public Health and Epidemiology from Seoul National University. Please help us welcome, from the World Health Organization, Dr. 𝗟𝗂𝗁𝗄. A round of applause, please.
Good morning, everyone. I would like to start recognizing the presence of very important people today, including Director Adriano Suban and also Ma Rose from the Central DOH, Dr. Jonathan, Assistant Regional Director of Central Visayas CHD, and together with Dr. 𝗣𝗿𝗆𝗀𝗆𝗆𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏 of Cebu Provincial DOH Office, Engineer Miguel, and Mr. Rowley from Cebu South and Cebu North. And then my staff, technical focal point for NCD management program from WHO Philippine office, Mr. Raj. And of course, I'm glad to hear that our provincial governor, Pamela, is #1 priority is health, and which was represented by Attorney Kevin this morning. And Dr. Sheila Fasio, provincial health officer, and many healthcare workers, including barangay healthcare workers from our local LGUs in the Cebu province, Bohol province. And we also have a presence from the 3 highly urbanized cities, Cebu City, Lapu-Lapu City, 𝗟𝗂𝗪𝗍. I would like to start that I love Cebu. As our dancing team shouted this morning, before coming to join today's meeting, I actually arrived to Cebu Airport early morning on last Friday. Because it's my first time visit to Cebu province, even if I arrived to this country in January last year. And I make a point, whenever I go to new places in the country, I make a point to scan through the parts, the provincials and municipal areas. So this time I made half of the island circuit road. So I went through first municipality I visited was 𝗟𝗂𝗁𝗍 municipality, and I visited the Cebu Technology University because I heard that their textile is beautiful. So I couldn't resist buying this 𝗟𝗂𝗁, which is a baby blue color, which is also WHO organizational color. So I'm wearing this now, and after that, of course, I moved to Oslo municipality to swim with whale sharks. And then I turned at the south point of the island. Actually, I was driving with my husband, who actually was stationed here for 2 weeks in Cebu Airport during the COVID time, because he was WHO consultant and he came to help Cebu City Health Team to establish a COVID PCR laboratory in this very big international airport at the time. So he has a very fond memory, but he stayed only 2 weeks and he couldn't get out of the airport at the time due to lockdown. So it was also first opportunity for my husband and me to see beautiful ocean of Cebu. And then we went to 𝗟𝗂𝗪𝗍 municipality, and then again to swim with the green turtles and a big school of sardine fish. And then we actually hurried a bit to come back here in Cebu City. So next time, I'm joining the launch of a PPSA program. But next time when I visit, I also would like to make a northern circuit. And then mainly to see how the PPSA program is flying in the municipality level. And then to see if there is any other support you need from WHO. As my staff, Raj, was very serious addressing all the issues around the NCD globally, regionally, and also in the Philippines. He quoted a lot of statistics, and then I think there are some numbers that we will have to remember. And as we have a lot of municipal leaders, LGU leaders here today, and then I understand that their daily business is really about achieving the SDG, Sustainable Development Goals. Mayors and then governors, it's their big business, which is basically government-driven targets. And then as Raj and some of our speakers mentioned, SDG 3, and WHO is actually custodian of SDG 3 indicators among many other UN agencies. And then we are a bit worried because the PSA, Philippine Statistics Agency, published the SDG Progress Report in 2025 for the 2024 situation, and it showed a little bit of a regression. And then so we, WHO, we actually made a bit more in-depth analysis why SDG 3 regressed in 2024. And then there were some indicators that were pulling down the overall SDG achievement. And then there are diseases like tuberculosis and HIV. And then I understand Cebu City is one of the high burden areas. HIV is actually mostly the urban areas diseases, and then the new infection rate was is quite high in the Philippines. So these are the so-called communicable diseases, even if it has achieved a fundamental reduction over a decade, but still there are ways to go. But at the same time, the NCD, premature death due to non-communicable diseases, is one of the indicators, together with the road safety indicator, road fatality, one of the indicators that actually pull down the SDG achievement of the country. So I'm talking about this because today we are talking mostly about the NCD, but I know that the municipal leaders, apart from health sector, there are many other sectors that they are taking care of. there's agricultural sector, there's tourism sector, there's education sector, there's a healthcare sector. And also amongst the many different healthcare programs, there are communicable disease program, there are non-communicable disease program. So all these pictures are in the mind of our political leaders. So that's important to acknowledge that. But why is this NCD program, and also particularly this PPSA program, Proteksyon para sa Altapresyon program, is so critical? Because, let me again give you some statistics, sorry to quote too many numbers. We all know that GDP, right? The health sector, health expenditure against the GDP of the country is 5.9%. Basically, 5.9% of GDP are spent for the healthcare in the country. The NCD burden, the cost that is caused by NCDs is explaining 4.8% of the GDP. So you can see the scale, how big the NCD burden is in this country. No wonder that the 70% of premature deaths are caused by NCDs. As Raj mentioned, the cancer, and then high blood pressure and diabetes, and then respiratory, non-communicable disease. So you can see the scale. And then to address this big scaled issue, challenges, not only one program wouldn't work. We need a kind of movement. And then, as Rose mentioned, it's a whole of the government, the whole of the society movement that we can actually move the needle. So that's why the presence of all these leadership today and technical officers and our healthcare workers are very important to move toward that achievement. As Raj also briefly mentioned, the economic, in the Philippines, the Philippine authority made already all the cost estimates, and then the investment case. If we spend 30 billion pesos in the country, not the Cebu province, in the whole country, if we spend 30 billion peso for the next 15 years, the economic return will be 360 billion peso. So what are we talking about in terms of investment? 4 programs: tobacco control program, alcohol control program, and then high blood pressure, PPSA program, and then physical activity promotion program. So these are the programs, and Maru's also eloquently mentioned. These are 4 programs. If we invest 30 billion peso, and then the economic return will be 360 billion peso, 12 times bigger, over 15 years. The irony of the NCD program, this investment will have to happen now, but the return will be later. So most often, if we don't assure the continuity of the programs over a decade, it won't really make much dent. So again, back to the concept of movement, continuous investment, and then we are all going together. That concept is very important to address NCDs. And then you could see from the graph, there is a comparison in our Western Pacific region. Philippines is in the middle, but who are lagging behind the Philippines? These are mostly Pacific Island countries. In the northern and southern Pacific, their obesity rate is almost like 80%. They are suffering from. But all the other, but their economic, social development status is different. They belong to the least developed countries, but the Philippines is already aiming to become the upper middle income country status. And then considering that development stage, we have a problem for the NCD programs. So I saw that when I arrived to Cebu City, highly urbanized city, you have beautiful bridges linking the islands. And then I could see it actually transitioned to smaller composite city. And then after that, municipalities, the transition, it's much more rural in the area. I'm sure that even if like 24 municipalities are first-class municipality, I can see Cebu province is quite affluent. And then huge touristic assets with beautiful ocean, and waterfalls, canyoneering water. But I'm sure that in the middle of all these wells, there are also unserved area, 𝗟𝗃 areas, some of the outer islands areas. So how we could reach there? I would like to end my speech saying that I think the real change, I happen to be from the Republic of Korea. Now I'm a representative of the UN system, so I'm not supposed to talk about one single country, but I just remember Korea used to be notorious of having very high salt content. Even now consumption, it's all from soup, because we eat a lot of soup. Every single meal, 3 times a meal, should have a soup. In the morning and afternoon, and you can already see how much salt is inside. We used to grow up in that high salt environment, but at one point, we start to hear that people are complaining when they eat out with their family in a restaurant. If the food served in the restaurant is too salty, people don't go there. And then they start to lose popularity. And then people start to complain about, oh, this food is too sweet. And I don't want this. Could you just put a little bit of sugar, just 1/10 of the sugar that you usually put? We are asking in the restaurants. So and also the people are very keen about the physical exercise. And then it's also partly because of some sort of commercial advertised body image kind of social pressure, particularly on women. So there was a very strong movement, the feminist movement, that why women's body are so much targeted by this commercial. But there was a pressure about good fitness kind of campaign. So that when we think about all this single change will have to come from each individual. But here who are present today all have that concept. We all know about salt, about sugar, about the importance of physical activity. But when you go to those far-flung rural areas, do people know about this? Probably not. I found that when I went to the rural areas, people know the importance of a reduction of sugar, but not many people were actually aware about the importance of reduction of salt. Because people are very aware about diabetes, but not many people link between the salt consumption and the hypertension. So this is the reality. So how we can make every single individual in the Philippines be aware and then put on pressure on themselves, on the society to make this social change. That's why we are here. And then there are strategic pillars from PPSA program, as Maros mentioned. Governance leadership, very important. Invest on this to control the NCD. The second element of is service delivery. Our healthcare worker, we know that how hard our healthcare workers are working, particularly barangay healthcare workers. We'll have to reach out to the community. We have a Puro Kalusugan program. Reach out to the community to screen as much as possible. And then the drugs and test kits and the blood pressure machine will have to flow so that they don't have any frustration delivering services. Data should flow also to know how much we are gradually achieving our targeted goals. And then more importantly, community participation and mobilization. Mobilization is a bit laid-back concept. Now, participation is more active approach, right? And then how to empower these people to understand. And then it needs a lot of health promotion activity and health education activity, behavior change activities. So all these things are very complex but doable area because there is a very nice toolkit and technical package and strategy from the government. So I'll just stop here. I don't want to lecture the choir. I know that all of us are the champion of PPA's program today. So thank you very much again to have invited 𝗍𝗿𝗁 here. We are providing a lot of support for the Central DOH and then CHD, Central Visayas, and also all our LGUs. So if you need any help or assistance, or if you have any questions, just do not hesitate to contact us. Thank you very much.
All right, so a meaningful message indeed, no? Thank you, Dr. Ko, for that message. And again, we sincerely hope you're able to enjoy the scenery and beauty of our province. Again, we welcome you to Cebu.
And as well, we give thanks and gratitude to our partners from the World Health Organization for their continued support in the various initiatives of the Department of Health.
Certainly, Zach. We are all but grateful for our speakers for taking the time, effort, and commitment in joining our activity for today.
All right, for our speaker earned his Bachelor of Science in Medical Technology from Immaculate Concepcion College in Davao City, Doctor of Medicine degree from Ateneo de Davao University, Davao Medical School Foundation. He completed his internship at the Armed Forces of the Philippines Medical Center, further pursued a Master of Public Health at the University of the Philippines, Manila, and a Master's in Community Health Management at the Ateneo Graduate School Business. He serves as the Director 4 of the Disease Prevention and Control Bureau, overseeing the various programs within the Department of Health, including mental health, cancer control, non-communicable diseases, environmental and occupational health, voluntary blood services, and organ donation and transplantation. Prior to his current role, he also headed the Office of the Drug Abuse Treatment and Rehabilitation Centers Operations, served as Director of the DOH Centers for Health Development in Western Visayas, Northern Mindanao, and Metro Manila. Among his notable accomplishments was the successful implementation of the Healthy Hearts program in Western Visayas, whose outstanding results became the model for the national rollout of the Proteksyon para sa Altapresyon initiative. Please give a round of applause for the Director for DPCV, Dr. 𝗟𝗓𝗄𝗆. A round of applause, please.
Mayong buntag Cebu. Nalipay kog dako na naguban-uban karong adlaw. But una sa tanan, gusto na ako ihatag akong dakong pagtahod sa atong STEAM partners nandiri sa Cebu, especially na naguban-uban sa ato karong adlaw. Una, siyempre atong Center for Health Development na atong Assistant Regional Director si Dr. Jonathan Erasmo. I do understand that he's virtually connected with us today. And of course, si Dr. 𝗣𝗿𝗏 atong Chief sa Local Health Support Division na naghatag sa tuwa sa yung ginahimo diri sa Cebu Province sa inyong mga initiatives regarding the hypertension prevention and control. I am truly honored to be sitting around the table with our World Health Organization, ang atong Philippine representative ng WHO, si Dr. Yunko. Mayong buntag sa iyo, ma'am. It's an honor really to be sitting around sa table na yan with the distinguished persons, not just in the Philippines, but worldwide from the World Health Organization. And together with her is Mr. Ras, kauban nato, pa from Mindanao to the Western Visayas when we implemented the Healthy Hearts Program. The NCD technical officers, palakpakan po natin sila. If not because of them, really successful natong Healthy Hearts Program in the Philippines. They planted the seed, we responded, and we accomplished a lot, and now we're scaling up nationwide. So that's because of the partnership and collaboration with the World Health Organization. And I also would like, ihatag po na ako ang dakong pagtahod sa atong provincial governor as represented by the Executive Assistant, si Attorney 𝗟𝗏𝗏𝗀𝗃. Sir, may buntag. Sa atong Provincial Health Officer 2, sitting beside me, si Dr. Sheila Fasiol. May buntag man, I used to be also Provincial Health Officer of the Nagat Islands before. So I know kung sa kalisod, unsang dakong ka-challenge ang sa ginadala sa atong Provincial Health Officer. And also, for the local government units of Cebu, Bohol Province, Cebu City, Lapu-Lapu City, and Mandawi City, na naakauban nato karong adlaw, may buntag sa inyo, taas na inyong kamay, inyong kamot, taas o dagan sa likod. May buntag atong city municipal health officers, atong public health nurses, atong midwives, ug labi nagyud ang atong barangay health workers. Ug kauban pud nato karon ang atong importante pod na health worker na nakababad sa mga probinsya, ang atuang DMO 5 sa Cebu South, si Engineer Miguel Tiggerson. Asa man si Engineer? Ang atong DMO 5 sa Cebu North, si Mr. Rolly Villarin. Ayan, nasa likod. Kumusta ka na, Tol? I used to be also a provincial DOH officer before in Surigao del Norte. So, kabalukon sa ginatrabaho sa ating mga kauban din ng DMO5. Sa una kasi, PDO head, ang atong team leader sa probinsya. And also with me from the central office is si Ma'am Rosemary Holandes, isa sa mga saligando sa atong bureau, sa Disease Prevention and Control Bureau, specifically for the population health and non-communicable diseases. And to all our community leaders with us today, atong tanang partners na nagban-uban sa tuwa karon, may buntag sa tanan. Okay pa ba kayo? Yes, okay pa tayong tanan. And it is really my honor to join you in this important launch of Proteksyon para sa Altapresyon, kung sa English pa, the Philippine Hypertension Prevention and Control Initiative. Ang atong ginahimo karon is more than a ceremonial activity. It is a milestone that reflects commitment, partnership, and hard work of local governments, health facilities, communities, and development partners toward isa ka klaro o coordinated approach for hypertension control in the Philippines. It started, piloted in Western Visayas, Iloilo Province, first district of Iloilo Province, and then expanded to a number of municipalities in the same province, then naadto sa Antique, then replicated in Aklan, then eventually, from 2025 up to karon, gi-cover na po niya ang Capiz Province, Guimaras, and the highly urbanized city of Iloilo. Pero kana, wala nahitabo tungod lang sa inyong Department of Health. Wala na nahitabo tungod lang sa pipila ka tao na nakuban-uban sa tuwa. Gisuportahan ka na ang pilot implementation in that area. That's why it was successful. And it was successful because it answered one of the major problems here in the Philippines. The cardiovascular diseases remain the leading cause of death among Filipinos, accounting for about 1 in every 3 deaths. Can you imagine? Isa sa takatulo kamatayon tungod na sa cardiovascular diseases. And hypertension continues to be one of its most common pero preventable risk factors affecting millions of Filipinos, many of whom remain undiagnosed, untreated, or unable to sustain long-term care. Daghan naman ta nahimo na initiative regarding sa blood pressure. In fact, according to Dr. 𝗟𝗏𝗪𝗏 kanina, it is, kumukuha kag BP, nakaidalang BP apparatus, stethoscope, it actually start a conversation. It is a conversation starter. In fact, I remember when I was still a doctor to the barrios in the mountains of Malita, Davao del Sur, and when I was transferred also, when I requested to be transferred in the province of Tawi-Tawi, serving the indigenous tribes of the Sama de Laut, and Sama de Ria, the Badjaus, madali mag-converse, di makukasulti silang sinultian, straight. Pero once they see you carrying a stethoscope o kining BP apparatus, muduol sila kay magpa-BP po. The same story in the mountains of Malita, sa mga mga Bilaan tribe, muduol sila. It seems na dali makakonect pag makakita sila sa atong BP apparatus o stethoscope. And the same thing when I was a municipal health officer in the mountains of Agusan del Sur in San Luis, dali makipagstorya sa mga manubo, sa mga manwa, kung makakita sila ng dala-dala ta og BP apparatus. It seems na ang pinaka-attraction nato as a health worker ang BP apparatus o stethoscope, magpaka og BP. Di ba, Doktora? Doktora Pasyol? Dali ta makakonect. Parang bang deliverable natin yon. In fact, pag nurse ka, sulti ni Dr. 𝗟𝗏𝗪𝗏 kanina, ang imong unang trabaho, kuhaan mo BP, ang taking ang imong mga pamilya, trabaho ni mo na. But, atong ginahimo karon dili lang ta magkuhag BP taking. That is not protection para sa Altapresyon. Kasama siya, wala siya nagtatapos. It doesn't end there. Ang pagkontrol sa BP, dili lang sa screening. Daghantag mga initiative sa una, sama sa atong bantay puso, bantay presyon, di ba? In 1996, dito sa mga isla, ato-ato sa bukid, tamukuhag, 15 years old and above, I remember. Nakakonekta, pero walay mission. There was no action taken after. Landas doing the master listing. Kung kinsa na high blood, kasi daily high blood. We started with the high school student, pataas, pero the other support na kailangan ipababa ilang blood pressure, murag kulang atong programa sa Department of Health during that time. Ang proteksyon para sa altapresyon is different. Kay kinahanglan natong maghimo pag daghan pang suporta para mapababa ang atong blood pressure. That is why our work cannot stop at screening alone. We must ensure diagnosis. Kinahanglan may bala nato kisa na blood pressure. Treatment, matambala nato kung kisa tong na blood pressure, mataas ang blood pressure. And regular follow-up kasi baka kinahanglan kambyuan ng yung treatment. Di pwede itong nagsugod ka sa isa katambal, yan nagkataas na yung impression, thinking na, tama lang itong tambal. Maybe there's also a time, a need to change your treatment. That's why there's a need to follow up. There's a need to refer you kung nilalaan na ang atong pagtaas sa blood pressure. Access to essential medicines, kinahanglan na naitambal. Kaya kung wala, dili po nato dayon makontrol, although there's a need for a lifestyle change, pero kailangan natong medicine po. And sustained blood pressure control. It requires a lot. Hindi lang siya magkuha tag BP, may balang kisa na taas of blood pressure, but we have to make sure na meron silang access of health services, na merong ma-follow up, and so referral kung kinahanglan. Yes, tama po itong gisulti na Ma'am Rose, that I was the regional director in Western Visayas when we piloted the Healthy Hearts program. This is in collaboration with a lot of partners. Hindi lang ito trabaho sa Department of Health. Daghan. Dili siya maging successful kung walay suporta gikan sa uban. In Western Visayas, through the Healthy Hearts program, has already nag-demonstrate na that a strong primary care system, simplified treatment protocols, trained health workers, reliable medicines, validated blood pressure devices, and functional monitoring systems can lead to better health outcomes for patients. So, importante na naghimot ang initiative na tubag sa kinahanglan sa problema sa kalusugan sa mga katawhan, pero mas importante po, nakabulota kung sa himuon. And in our pilot sites, gihimo nato na identify nato kung sa mga epektibong himuon para maghimong successful ta. O kana nga atong ginahimuon sa atong protection para sa altapresyon. We know the problem, we know what to do. Kinahanglan nato lang magtinabangay and the commitment to make sure that we're going to push our agenda forward para mas daghan maka-benefit, mas daghang tao masalba nato kay mababa man ang ilang blood pressure. The reported high blood pressure control rates in the pilot sites, this is actually in Western Visayas, prove that when the system is organized around people's need, kung nag-mobilize na tungod sa panginahanan na tinuod sa katawhan, lives can be protected and saved. Kay tama man natong tubag, kay ato mang napindot, natugbok, kung unsa gyud ang ilang kinahanglan. And sa Pilipinas karon, ang one of the 3 deaths is due to non-communicable diseases, the cardiovascular diseases, ang pinaka-preventable is ang i-control ang blood pressure sa matong buhaton. So that is the very foundation of proteksyon para sa altapresyon. Let us not forget that one. Wala tayong nagahimog initiative, base lang kung sa atong gusto himuon, but miagi na sa atong experience na sa bang parte sa Philippines. We're scaling up. Ibig sabihin, successful, and we would like this success story to be also the success stories of other areas in the Philippines nationwide. Kay mga Pilipino, wala raman sa isa ka region. Pilipino tatanan sa Pilipinas, and therefore, we should provide the same services that benefited a number of lives, saved lives in our pilot areas. And through this initiative, the Department of Health aims to bring hypertension, prevention, and control closer to every Filipino family. Naman tayo puro kalusugan, gidala na to ang mga serbisyo sa puro. Now, let us make sure that we'll be bringing the services within the household, within the family, closer at ang mga services sa ilaha. We envision communities where adults know their blood pressure, where those diagnosed with hypertension are promptly treated, where medicines are available, where follow-up is continuous, and where local health systems are accountable for helping patients achieve blood pressure control. The primary objective nato is to control that blood pressure. We know the problem, kabalo talaga nangamatay, kailangan nato i-control ang blood pressure, but we have to make sure na ma-monitor nato para ma-attain nato ang reduction sa blood pressure. And we also recognize that this cannot be achieved by the health sector alone. Ato nang balik-balikon, ang aktor ani dili lang kita, dili lang sa health sector. The success of this initiative will depend on the following. One, the leadership of our local chief executives. When we implemented the Healthy Hearts program in Western Visayas, lesson learned talaga ito. Nakita po namo by observation. Those local chief executive na hands-on, na mismo siya mo atubang sa media, may istorya sa atubangan, sa mga gatherings, about Healthy Hearts program, these are the areas na very successful ang ilang implementation. So we need the role of the leaders, our local chief executives, and we're glad really, nalipay tagdako, nakauban nato diri ang taga provincial government, the PHO, and the executive assistant, the provincial governor. And the provincial governor will be meeting us this afternoon, right? At 6 o'clock. Uyang gabi, paistoryahan nato ang proteksyon para sa Altapresyon. That is really a testament, ebidensya, that the provincial government of Cebu province is really supporting protection para sa Altapresyon, di lang para sa tuwa, sa ilahabat, para sa katawhan sa taga Cebu. Palakpakan po nato ang provincial government of Cebu. Ikaduha, the commitment of our health workers, commitment nato, the secondary health stakeholders, ang mga implementers, tayo, dili pwede mag-istorya lang. We have to make some commitment. We have to go up in the mountains, go to the urban areas kung asa yung mga informal settlers. Talk to them. Kasi naibalaan man gud nato sa Pilipinas, gi-review nato ang atong mga records. Based on the National Nutrition Statistics, 10 million Filipinos, 20 years old and above, taas of blood pressure. Survey yan, ha? And then, gi-review po nato ang atong records sa FSIS, kanatong gina-report, di ba? Weekly, monthly, quarterly, annually. Gina-reports. Pinabalaan nato na 3 million lang nasa listahan. So, kung 10 million sa Pilipinas, based on the National Nutrition Survey, those 3 million lang nasa listahan sa atong mga records, atong health facilities, asa di ay ang 7 million. Mo na atong pangapangitaon. Na kini mga 7 million, including the 3 million na na-cover na, natagaan og serbisyo, ang masustain ang mga serbisyong dapat ilang maangkon, na ilang madawat ang mga tambal o ma-follow up po sila, ma-monitor. So that's actually the reason why we have the protection para sa Altapresyon to look for that 7 million. That could be any one of your family members, wala takabalo. Maybe of your neighbors, na wala lang takabalo, na bigla na lang na stroke, bigla na lang myocardial infarction, bigla na lang na magdialysis kay nasira ng kidneys, kay taas na iyang blood pressure. So kinahanglan na ito ang commitment natong tanan sa atong health workers. Kaduha na, ikatulo, the support of our communities. Dili pwedeng wala tayo support sa communities. When we go down to the purok, to the sitios, sa mga balay-balay, kailangan natong suporta nila. We need the community leaders. We need the community health volunteers. The barangay health workers play a very important role. So, kinahanglan natong suporta sa komunidad. Ika-upat, the continued partnership of organizations such as the World Health Organization. Maraming salamat, daghang salamat sa World Health Organization. Uguban pa, daghantag kauban na civil society organization. That's what we did in Western Visayas. Top all. The business sector, the academe, ang kanang mga malls diha, istoryahan nato ng SM, Robinsons, Gaisano. Baka pwede mo mag-conduct of activities within, including those mga companies, mga national government agencies, non-government organizations, people organizations, you top all. Kasi natin pangitao na 7 million para man sa tuwan tanan. I-screen nato 20 years old and above to make sure para may bala nato kisang walay high taas ang BP, kisay taas ang BP, kung taas ang BP, dapat i-follow up, tambalan, i-monitor siya, tagagtambal, para ang purpose mababa yung blood pressure. So, kinahanglan natong suporta sa tanan. Ang sulti nga ni Ma'am Rose, it's a public-private partnership. Tinood po na. And we've proven during the COVID-19 pandemic na hindi lang kitang actor when it comes to health services. We need the support of the other sectors. Dako nga tong role, po kinahanglan nato ang tabang nila kay we are targeting the whole Filipinos looking for that 7 million na wala sa listahan na appeal na natagaagtambal. And then hypertension control must be institutionalized in the form of local policies, operational plans, budget, service delivery system, and health promotion activities. Sa presentation kanina, by 2026 to 2027, dapat na-institutionalize na nato ang atong proteksyon para sa altapresyon. Na natay mga local ordinances and local mga resolutions in support of the protection para sa altapresyon. In our operational plans, from the barangay health plan to the municipal health plan, to the provincial health plan, city health plan, at the regional mga plano nato, dapat na ipasok na siya doon. Dapat mayroon naka-allocate doon na budget kasi useless kung na plano na wala na may budget naka-allocate kasi let's face it, we need also support, right? That's why we need the support of the legislative. There's a need to sit down doon sa local health board, pag-usapan ang protection para sa altapresyon, mulingkod sa mga legislatives to push our agenda forward para merong tayong budget allocation and service delivery system. Sanawa na ito, including the referral system, information system, para ma-monitor na ito. Dapat na-tap na ito tanan na siya. The delivery system, dapat intact siya, functional siya. And of course, importante, the health promotion activities. So this require actually the participation of almost everyone. Hindi lang at the regional level, provincial level, sa municipal, the city, kasi mayroon kayong 3 highly urbanized cities, the barangay level, but even at the level of the household. Baka pwede natong pangutanon ang pamilya, kisa ba inyong household caregiver kung ay magkasakit sa inyo? Nabay sa inyo kabalo mo ka blood pressure? Kabalo ba sa inyo, nabay sa inyong pamilya, kabalo sa pag-navigate as a dalon na pasyente, i-refer? Those are the information that we would like everyone at the level of the family makuha nila. Na nasa po sila yung role. They're not just only a recipient of health services, but they're part of health service provision. And dagantag pagkahimuon, di po ba? And much of my stories that I shared to you actually are the lessons we learned when we piloted the Healthy Hearts program. It will not be successful without the support of everyone. Dapat naka-on-board, owned and co-owned by our local leaders and the health workers as well. And we have to co-create solutions. Lingkuran nato, istoryahan, kung usapay pwede natong himuon. And on behalf of the Department of Health, sa atong Secretary 𝗟𝗏𝗄, I express our full support to Cebu Province for your launch of proteksyon para sa altapresyon. And through this initiative, may we renew our shared commitment to reduce premature deaths from cardiovascular diseases, strengthen hypertension services in every locality, and build healthier, stronger, and more health-safe communities. Ang gusto nato makita, walay Pilipino na mamatay of non-communicable diseases, lalo na kung taas na yung BP, mamatay siya before reaching the age of 70. At tawag na premature death. Dili na to sila mamatay before reaching the age of 70 simply because wala na ibalaan na taas dahil ang blood pressure. Simply because wala siya may balik pa konsulta pag follow up. Simply because wala siya natagaan og tambal. Or simply because di lang siya aware na siya taas dahil ang blood pressure. That will be really a tragedy for the Filipinos. Kasi kabaluta, one of the 3 deaths sa Pilipinas, NCDs, the cardiovascular diseases, and contributing factor is the uncontrolled blood pressure, yung pagtaas hypertension, na pwede naman tanay mahimo diha. And to our local governments and health teams, labi na karon nagban-uban ta karon, nagpasalamat kog dako for showing that this can be done, which you have already started, I'm sure. And maraming salamat for your leadership, your persistence, and your commitment to making primary care work for our people. And together, sa atong pag-uban-uban, let us make proteksyon para sa altapresyon not only a program, but a promise. In the words of Dr. Yonko, tawag nito, a movement. We're going to make this a movement and a promise that we're going to make sure that the implementation of proteksyon para sa altapresyon in the Cebu province will be successful, not for us, but for those who are residing in the province of Cebu. That every Filipino with hypertension will be found, makitaan siya, will be treated, followed up, and supported toward better health. And puso sa puso, daghang salamat sa inyo at mabuhay po tayong lahat.
All right, thank you very much, Dr. Subaan, for that message of support. No, furthering the point of the launching of this program as well as its importance. So before we proceed to the next part of our activity, we would now like to call on to give their message of support the Provincial Health Officer 2 of the Provincial Government of Cebu, Dr. 𝗟𝗂𝗁𝗍𝗄𝗆. A round of applause, please.
Maayong buntag sa tanan? Buntag pa? Okay. So, Director Adriano Subaan, Miss Rosemary Holandres, Dr. Jonathan Neil Erasmo, Dr. 𝗣𝗿𝗁𝗍𝗄𝗆𝗀𝗆, our PDO host, Engineer Miguel Gerson and 𝗟R𝗂𝗏𝗆 Villarin, Representative for WHO, Dr. Yun Yong Ko, and of course my friend, Sir Raj, Attorney Dinsay, our local government units in the province of Cebu and of Bohol, Cebu City also, Lapu-Lapu and Mandaue, our city and municipal health officers, public health nurses, midwives, barangay health workers, maayong buntag once again. So, for many years, hypertension and cardiovascular diseases remain to be the leading cause of mortality and morbidity in our communities. To address this public health change, we need a unified, multi-sectoral approach combining health promotion and education, early detection, and sustainable lifestyle interventions. Proteksyon para sa Altapresyon is a fitting initiative to help address the challenges of the program. By uniting all our efforts, we affirm our shared responsibility to reduce the prevalence of hypertension and build a healthier, more resilient future for all. And that no Cebuano is left behind. And with Governor Pam's top priority, which is health, we can achieve that health for every Cebuano. As a silent killer, we will not let hypertension silently claim the health of our community. So we in the provincial government fully support the initiative of the Department of Health, which is the proteksyon para sa Altapresyon. Daghang salamat ug maayong buntag natong tanan.
All right, thank you so much, Dr. Scholl.
So at this juncture, we'll be commencing or we'll be proceeding with the ceremonial turnover of proteksyon para sa Altapresyon kits. No?
And now, may I call on the presence of Dr. Baton, Dr. Albito, and Dr. Sheila Paschal and Attorney Kevin Dinsay.
Here in front for the ceremonial turnover. As well, we would also like to call on our DMOs for this ceremonial turnover. So here in front, we would like to request the presence of Engineer Gerson as
And
well as
𝗟R𝗏𝗏𝗆 Villarin.
yes. So this turnover not just further cements the collaboration between the Department of Health and the Provincial Government of Cebu, but rather ensures that the implementation of the Proteksyon para sa Altapresyon program will push through and will be implemented. So can we give them a round of applause, please? Okay, so at this juncture, maybe also call on our speakers to join for this ceremonial turnover as well as the photo opportunity, please. Yes. Here in front. Okay. 1, 2, 3, smile. 1, 2, 3. One more, smile. All right. Thank you very much, no, for our speakers, guests, and our representatives.
Yeah, and also our staff from the DOH Central Visayas CHD as well.
Yes. All right. So at this point, we will be proceeding with the acknowledgement of our LGUs, which is going to be starting with the Certificate of Appreciation.
Okay, to assist us in handing over these certificates of appreciation, may we request on stage.
Yes.
On stage, Dr. 𝗟𝗂𝗏𝗃, Dr. Joan Albito, and also...
Yes. Okay. All right. So for the first certificate, okay, apologies for that one. So before we proceed, we would like to first read the citation.
Yes. Okay. Certificate of Appreciation is presented to Provincial Government of Cebu for its invaluable support and partnership in the successful conduct of the launching of the Proteksyon para sa Altapresyon program for Cebu Province. Your commitment to strengthening non-communicable disease prevention and control has greatly contributed to the advancement of healthier communities in Central Visayas. Given the 30th day of June 2026 in Cebu City, Philippines, signed by Joshua G. Brillantes, Director 4 of DOH CHD Visayas.
Okay. So at this point, we would like to call on our representatives from the Provincial Government of Cebu here on stage to accept this Certificate of Appreciation.
Same certificate is also given to the Disease Prevention and Control Bureau.
So kindly proceed here on stage, please.
And also, same recognition is also given to World Health Organization. Our applause, please. Okay, let's move forward to the giving of the Certificate of Recognition for Support. Let me read the citation first. The citation for its involves contribution and steadfast commitment to the implementation of the Hypertension Control Program, demonstrating exemplary support in advancing hypertension prevention, early detection and management, thereby promoting better health outcomes for the community, given the 30th day of June 2026 in Cebu City, Philippines, signed by Joshua 𝗟𝗂𝗍𝗍𝗍, Director 4 of DOH CHD. This certificate of recognition for support is given to Provincial Government of Cebu.
So we'd like to call on the representatives. All right, thank you very much, no?
Okay, at this juncture, let's also give the same certificate to City Government of Cebu.
So our representatives for the City Government of Cebu, kindly please be here on stage to receive this certificate of recognition for support. Okay, thank you very much.
Okay, another certificate of recognition for support is presented to City Government of Lapu-Lapu. A round of applause, please.
All right, 1, 2, 3, smile. Strike your poses.
Okay, last but not the least, certificate of recognition for support is also given to City Government of Mandaue. A round of applause, please. Okay, also another certificate of okay.
Okay, so our representatives from the City Government of Mandaue, Ms. Jane.
Represented by Ms. Jane Ragas, our DMO. And also another certificate of recognition for support for Provincial Government of Bohol. A round of applause, please.
All right. So at this juncture, we will now be presenting the certificate of recognition. So for a quick description, this recognition from the Department of Health Central Visayas Center for Health and Development honors the local government units that demonstrated exceptional performance in the implementation of the 2025 Philippine Package of Essential Non-Communicable Diseases Intervention, Risk Assessment, or PhilPen. Through their unwavering commitment and collaborative efforts, they have achieved the highest percentage coverage of their target population for LGUs in Cebu Province, significantly advancing the early detection and prevention of non-communicable diseases within their communities. This recognition celebrates their dedication to their delivering quality primary health care and improving the health and well-being of their constituents. So for the citation.
Okay, certificate of recognition is presented to Municipal Government of Bantayan for achieving the 5th highest coverage in the 2025 Risk Assessment of the Philippine Package Essential Non-Communicable Disease Intervention, or PhilPen, in recognition of its outstanding commitment to excellence and performance in strengthening the prevention and control of non-communicable diseases. Your dedication and every efforts in advancing quality health services have significantly contributed to the promotion of healthier communities and improved health outcomes. Given this 30th day of June 2026 in Cebu City, Philippines, signed by Director 4, Joshua 𝗟𝗂𝗍𝗍. An applause, please.
So to also facilitate in the receiving of this certificate, may we call on the presence of our DMO, Sir Rolly Villarin, here on stage. Thank you very much. Okay. All right. Thank you very much. So for the next certificate, may we call on also the presence of Engineer 𝗟𝗂𝗁𝗍𝗏 for...
Okay, another certificate of recognition is hereby given to Municipality of Boljoon. A round of applause, please.
Engineer 𝗟𝗂𝗁𝗍𝗏 for the receiving of the certificate.
Okay, another certificate of recognition is hereby given to Municipality of Sugod. A round of applause, please.
Another certificate is given to the Municipality of 𝗟𝗂𝗏. A round of applause, please. And lastly, for the highest coverage, may we call on the Municipality of Pinamungahan. A round of applause, please. Okay, so our representatives, please come up on stage so that we may be able to take photo opportunity for this certificates.
I would like to highlight, though, that the Municipality of Pinamungahan got the highest coverage. Yeah. Okay, thank you so much, Doc Baton and Doc Alvito. And again, thank you very much to our doctors, representatives, speakers, and participants.
Okay, so to further solidify the allegiance in raising awareness against hypertension, and for today's program, we will now take our oath or pledge of commitment, and this will be led by the Nurse 5 of the Non-Communicable Diseases section, Mr. Clark Kevin A. Trosio. A round of applause, please.
Okay, so may I request everyone to please stand. Kindly raise your right hand and repeat after me as we say our pledge of commitment. We, the stakeholders and partners of Proteksyon para sa Altapresyon, pledge to work together to prevent and control hypertension, promote healthy communities, and ensure better health for every Filipino. Together we commit. Together we act. Together we protect. Thank you very much.
Okay, and at the juncture, we are requesting all of our participants to come here in front and show their allegiance and duty.
Okay, so for the ceremonial signing, as well as the end of our logo, may we call on our guests and speakers for this one. For the Provincial Government of Cebu, as well as the Disease Prevention and Control Bureau and the Department of Health, 𝗟𝗍𝗄𝗎 CHD, as well as the World Health Organization. So please. Here in front on for the center stage. So now, at this juncture, we will be then proceeding with the ceremonial signing.
Okay, we're all requesting all of our participants to come here in front and show their allegiance and duty by signing the wall of commitment. The sequence in signing will be, first we have the guests and speakers. Next we have the representative from different municipalities. Okay, I will read again the sequence in signing. First, we have the guests and speakers, followed by the representative from different municipalities, our dear DMOs, barangay healthcare workers, and lastly, our other participants.
So you may proceed here,
You may
please.
now proceed for the signing of the wall of commitment. Thank you so much.
So again, first, the representatives from the different municipalities, you may come here in front for the signing of our commitment wall.
Ngayon kamo sa Serko sa Konsolasyon! pagahandumon sukad ni adtong panahon. Ang sarong kaamag sa katauhan sa matangkad lang nagkauban. Sa kakugi o paningkamo aron ang damgo matabot. Ang sarong katong kabati sa kinabuhi akong nabilin. Ipayo magambahan kay kini alam natong tanan, natong tanan. Sarong, sarong, sa ulo ng kalampusan. Sarong, sarong, nasa katong isa katauhan. Manalipon sa ulan ng init, mga kasangitan sa langit, magsaga sa talang panahon. Sarong sa konsolasyon, napadayon ang paglambo, o bidungog atong paghampo. Ubang kami sa narsiso atong patron, mabuhi ka o konsolasyon. Sarong, sarong, isa ulo ng kalampusan. Sarong, sarong, sa katong isa katauhan. Manalipon sa ulan ng init, mga kasangitan sa langit, magsaga sa talang panahon. Sarong sa konsolasyon, manalipon sa ulan ng init, mga kasangitan sa langit, magsaga sa talang panahon. Sarong sa konsolasyon.
Okay, thank you so much, 𝗟𝗂𝗁𝗍 from Consolacion. What a great performance to Japes.
A very good performance, Zach, no? So again, for other participants who have yet to sign, you may proceed here in front, especially for our barangay health workers as well as for our other participants who have yet to sign our Pledge of Commitment wall.
I think a lot of people na sign the wall of commitments.
Yes, a
And
lot of
it,
signatures.
really signifies the support of this activity.
As well as for the launching of this program, we can all see the support given by our participants for today. Usually in these events, the wall is very covered, no? Overlapping sometimes are the signatures.
Okay, would like to call the attention of the owner of the vehicle, Navara, with a plate number 𝗟𝗂𝗁𝗍923. Please attend the reception parking area. Again, the owner of the Navara with a plate number 𝗟𝗂𝗁𝗍923. Please proceed to the reception area po. Thank you so much.
As we can see, quite a turnout for our activity for today.
And we now have our barangay healthcare workers. We're so happy now to see them here,
Yes, and
attending the activity, and also seeing them signing the wall of commitment that shows support, unwavering support to the success of this program.